Hello, my name is Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today on our show, I'm joined by Anna Gabaree. She is the nurse supervisor of the Family Birthing Center at Northwestern Medical Center. She's worked at the hospital for 11 years, beginning her journey as a scholarship student. Mm-hmm. And well, you got your Bachelor's of Nursing degree, so that's terrific. She's also a native of the area, and she grew up in Fletcher. Yep. Is that right? Mm-hmm. So thank you so much for being here to talk about the Family Birthing Center. And I got a few questions about maybe breastfeeding and skin-to-skin contact, so we all know what that really means. Yeah, but first, let's start off by the Family Birthing Center. Talk a little bit about what goes on there and maybe what your role is.
Sure. So like you said, I'm the supervisor of the birthing center. We are a rural community birthing center delivering about 450 to 500 babies a year. Right. We really try to view birth as a holistic, personal journey. So we really try and support whatever the family's decisions are on the birthing center.
Well, that's terrific. So that experience, so how do folks get acquainted with the Family Birthing Center? Do you provide tours, or how
Absolutely.
do you get them comfortable before they have that experience?
Yeah, so one of the things that we do is we offer a Healthy Beginnings class throughout the pregnancy that you can do through Northwestern OBGYN. And through those classes, you can come and tour the birthing center. And even if you choose not to participate in one of those classes, you can call anytime and come on up and we can give you a tour of the birthing center.
So they can just call the unit and folks will get them connected?
Absolutely, yep.
That's terrific, making it easy for them.
Absolutely.
Awesome. So, one of the, because, I'm a nurse too, but I'm not a baby nurse, or was not. And so I don't know so much about the language that you use. And so skin-to-skin contact. Right. So what does that mean to the mom or to the family?
Right, so skin-to-skin is one of the new evidence-based guidelines for perinatal care. So basically what it means is immediately after the baby's born, the baby will be placed right on your skin, either the naked baby right on mom's naked chest. Mm-hmm. If you're not comfortable with that, we can do a diaper naked on the mom's chest, or you can just do cheek-to-skin. Any amount of skin-to-skin is a wonderful thing for the baby, and it's so important in the transition for both mom and baby. So it does a lot of, it's good for bonding, but there's a lot of medical guidelines that go behind skin to skin, so it can help to prevent postpartum hemorrhage in moms.
Oh, wow.
Bleeding really heavily because it releases oxytocin. It helps reduce pain response in moms so they feel less pain. It regulates mom and baby's temperature and heart rate. So studies have shown that putting babies on moms, they can warm up faster than if they were put on like our radiant warmers that we have. So also for babies, it stabilizes their blood sugar. It does all kinds of really amazing medical things, and it also happens to help with breastfeeding and bonding. And really, studies have shown that placing babies skin to skin immediately after birth, they have a better chance of successfully breastfeeding, and it can really help with growth and development for the babies.
So that's wonderful. So is the skin to skin just for the mom and baby, or is it also, is there evidence that supports the dad or the grandparents? Or?
Yeah, so this is something that's been really cool that we've seen. We absolutely support anybody doing skin to skin with the baby. It's such an amazing bonding experience. So mom's significant other or grandma, and that's actually something we really recommend if there's some sort of an emergency or mom's not sleeping and really needs to sleep and the baby's fussy. We recommend dad or mom's support person that's with her to do skin to skin with the baby. We have the babies do skin to skin for painful procedures. So if they're needing to have some blood drawn or something, we'll have daddies hold the baby right on their chest, on their skin. So, and if you think about when you don't feel so good, how good it feels to be held, we really encourage that for our babies too.
Oh, that's so wonderful. Now, what if someone has a C-section? Mm-hmm. Are you still able to do the skin-to-skin contact?
Absolutely, and that's been one of the most amazing transformations that I've seen at Northwestern Medical Center on our birthing center. So it's been this really awesome collaborative effort. So In the past, we used to separate moms and babes. The babe would be born by C-section and the baby would be whisked upstairs. And over the last couple of years, now the baby's born, it's quickly looked over by the pediatrician to make sure it's stable. And within about 5 minutes, as long as mom and baby are doing well, the baby goes right skin to skin in the OR. And stays there through the rest of her surgery. Dad or mom's support person can be right there helping mom to hold the baby if she's not feeling the greatest. And the baby stays there and they do the whole recovery period together. And it's been really cool to see. We've found that our moms require much less pain medication after their surgery if the baby is able to stay right on mom.
Wow, just comforting each other.
Yes, absolutely.
So that is so cool. Now you mentioned also about the baby kind of rooming in. Is that also new? Because I know when I'm out rounding, I don't see too many babies in the nursery.
Right.
So, and even though you might be busy. So what's happening with that?
So we really don't have a nursery anymore. We refer to it more of as a newborn observation area, and it's really a space for when babies need closer observation. Studies have shown that when babies can stay with their moms and room in, they're much happier. Parents are able to learn the baby's feeding cues and really get to know their baby. And what a better time is like their first little parenting lesson. Keep the baby with you while you have nurses there to support you with questions. So because the parents are able to be with their babies, and we highly encourage this, they can pay attention to their feeding cues and really be attentive to the needs of the baby. And it can actually, that helps facilitate breastfeeding too, helps again with growth and development by keeping moms and babes together.
That's wonderful too. So, okay, you've mentioned breastfeeding a few times.
Yes.
So talk a little bit about the importance of breastfeeding and how do you prepare the mom for that experience?
So we all know breastfeeding is really good for us. There's many health benefits. For babes, it can reduce the risks of ear infections. It can reduce the risks of upset tummies and gut infections. They can have better immunity also, so they get sick less. For moms, it can reduce rates of breast cancer, ovarian cancer.
Wow.
And it can, and again, immediately after birth, placing a baby to breast can help reduce risks of postpartum hemorrhage or bleeding really heavily. So like I said, there's many benefits to breastfeeding. So to prepare for breastfeeding, we highly recommend that you reach out and do attend those Healthy Beginnings classes. We talk a lot about feeding choices. We really want to respect people's personal decisions, but there are risks and benefits for everything you do in medicine and the choices you make every day when you're parenting. So I recommend just educating yourself about different feeding options, attending the Healthy Beginnings classes, and reaching out to the local lactation consultants. WIC has a really great program for supporting breastfeeding moms. And I think to prepare is just educating and asking the questions, and it can be scary for some women.
Absolutely.
And it can be hard, so just education is so important when you're pregnant, so you can prepare yourself better for after the baby's born.
So the baby's born, how long do they usually stay? So the education must be just kind of so short,
Yeah.
So what do you provide for education so the moms and dads go home with a good education, and then is there any follow-up after that as well to check on them?
Yep. So basically, while you're in the hospital, we educate on a number of things for both mom and baby in the immediate transition that happens after delivery. So things like safe sleep are really important. Risks of secondhand smoking. We do a lot of breastfeeding support. We educate on skin to skin and the importance, like maybe your baby's fussy at home, just put your baby skin to skin for a little bit. We talk about, risks of things like infection and signs to look out for. follow-up for the babies. Every mom is offered a lactation referral or a home health referral, and we work really closely with our home health agency and our local Department of Health. They're a great partner. And then all of our babies will have a visit with their pediatrician within a couple days after going home. And then we also recommend we do a 2-week postpartum visit, and it's like the 4th trimester visit through Healthy Beginnings. Well, you'll come back to the hospital and meet in our Healthy Beginnings room and discuss those early postpartum issues that you may be experiencing.
Great. So you really do wrap around
Yes.
the patient, the mom and the dad to help them with that experience.
Right.
It's terrific. So tell me a little bit about your team. What's the qualifications of your team, and talk a little bit about, their passion for this type of nursing.
So we have a wonderfully diverse team as far as experience levels and where we're at. We have, I think, one of our nurses has been there for 40 years, and we have a number of people that have been with us for over like 30 years.
They've delivered a lot of babies.
Yeah, some of them are on their 2nd generation. And then, we have a couple of girls that have just joined us within the last few months. They're very passionate women. They love what they do. They're very current in their practice and their evidence, and a lot of them have really embraced going above and beyond and getting their specialty certifications in maternal newborn nursing and inpatient obstetrics. And some are beginning to get their certifications in pediatrics also.
Excellent.
So it's a really cool team.
Wonderful. Mm-hmm. So if you have normal deliveries there, and so what's the extent of the practice on the Family Birthing Center? I'm assuming, you deliver most babies, but what happens if there's something a little bit more complex? How does that work?
Right, so we are essentially a low-risk facility, but the really nice thing is we're just 17 minutes down the road from Fletcher Allen. So if a baby is requiring, or mom is requiring more critical, then we can easily transport them down quickly to where they need to be. We have a really close working relationship with the NICU. They come to us and stabilize babies and bring them down. So it's a really good working relationship there. But that being said, that doesn't happen a lot. We provide really good services and have a really skilled team to be able to keep our families together in St. Albans.
So I know you're working on a special project, and it's baby friendly.
Yes.
Right? So just quickly, what does that mean to you and to our community?
Absolutely. So baby friendly, I'm sure you've heard a little bit about.
I have. I'm excited about it.
It's supported by the WHO and UNICEF, and it's actually a global program to really give babies the best start and to promote health in moms and babies and communities. So we are on this path to baby friendly. We're getting close to the end of the journey. It's really a comprehensive program looking at current best practices and really educating staff and educating the facility at large on the importance of breastfeeding and skin to skin and rooming in and all those really cool things that we've been doing. The really neat thing that we've learned on the baby friendly journey is if for some reason, a mom may be readmitted to the hospital for maybe she needed to have surgery or something, and she still needs support with lactation or helping to feed her baby. We've really worked on educating the rest of the staff on different units on how to support these families and keep families healthy.
Great. Well, thank you so much. It's been wonderful to talk about the Family Birthing Center, what it means for skin to skin and the importance of breastfeeding. And then I just really love how you wrap around the patient, and I feel your passion, and working at the hospital, I know it's sort of the best place to have a baby because you care so deeply for the community. And as you said, some have been there for 40 years, and so they're taking care of generations of babies. So thank you so very much. It's really been a pleasure, having you on this show.
Thank you.
And this is Jill Bowen, CEO of Northwestern Medical Center. Thank you for joining us to talk a little bit about the Family Birthing Center at Northwestern Medical Center. Thank you.